So we just did the flexors. So on the little finger side, remember we have the ulna. So the muscle we looked at here, because its tendon is anterior, was the flexor carpi ulnaris. So if we go to the posterior aspect of the arm, the muscle that sits right next to it, notice its tendon goes to the posterior aspect of the wrist, is the extensor carpi ulnaris. Now as we rotate the arm around, then recall that this muscle was the flexor carpi radialis, and between that is brachioradialis, and then two smaller muscles that we see just next to brachioradialis, which are going to be our extensor carpi muscles. So we have one that's long, one that's short. They're on the radial side of the arm, so they're extensor carpi radialis longus and extensor carpi radialis brevis. So now we're going to move to muscles that attach the lower extremity to the os cox and sacrum, and we're going to start in the posterior region, or the buttocks. So the large muscle that defines the shape of the buttocks is the Gluteus Maximus, and its origin is going to be on the iliac crest and sacrum, and then it crosses the hip joint and inserts on an area just below the greater trochanter of the femur. If we go deep to the Gluteus Maximus, we can find some other muscles. So if we look in the lateral compartment right here, we can actually see one of the muscles that is associated with the Gluteus Maximus, and this muscle would be the Gluteus Medius that we're seeing here. This model actually gives us the best depiction of how the three muscles, Gluteus Maximus, Medius, and Intermedius, overlap with one another. So the muscle that's been cut here, that would have attached here, was the Gluteus Maximus that we just looked at on the other model. The muscle lateral to that we just looked at was this one that's been cut, which is the Gluteus Medius that would have connected here. And so now we see a deep muscle underlying the Gluteus Medius, which is the Gluteus Minimus. The medius and minimus both attached to the greater trochanter. If we look inferior to the Gluteus Medius and minimus, then we can actually see a very deep muscle, which is called the Piriformis. So a clinical issue that's interesting is that just under the Piriformis, which is covering the greater sciatic notch that we learned, is the sciatic nerve that comes out. So oftentimes when this muscle gets tight, it impinges on the sciatic nerve and creates sciatic pain in patients. So we have a very small muscle that usually is always found where your major arteries and veins, the femoral artery and vein, exit the abdominal wall. And so it's a little tiny muscle called the pectineus muscle. As we move inferior to the pectineus muscle, we have a muscle that is an adductor of the leg, and it's long, so we call it the adductor longus. Now, because with models we can't always move muscles around like we could with a cadaver, what they've done is they've tried to open a little window between the pectineus and the adductor longus. And in here you would see a deeper muscle that's short, so it's called the adductor brevis. So we have adductor brevis, adductor longus. And then if we look at the medial aspect of the leg, we see a fairly broad muscle here coming off the ischial tuberosity, and it's the biggest of the adductors that is found in the leg. We can actually see it here, we can actually see it in a little window here, which is the adductor magnus muscle. And then we have a couple of other muscles that are crossing this hip joint as well. So a muscle that arises on the anterior superior iliac spine and then runs down to this broad tendon that we call the iliotibial tracker IT band is the tensor fasciae latae. So remember, the word tensor means to make a body part rigid. So when this muscle contracts, it increases the tension on this broad connective tissue, which makes the lateral aspects of your thigh feel really firm. A muscle that arises next to it is the Sartorius muscle, and it arises off the anterior superior iliac spine. It crosses from lateral to medial and inserts on the tibia, and so it's a muscle that helps us cross our legs. Once we've found the Sartorius, if we keep moving medial, there's a thin muscle that overlies the Adductor Magnus just posterior to the Adductor Longus, which is the gracilis muscle. And then the other hip flexors pass through a large foramen that we learned in our hip, the obturator foramen. And so we have a muscle that sits in the depression we learned on the inside of the ilium, the iliac fossa. So it's called the iliacus. And then medial to it is a muscle that runs up the side of the vertebrae, which is called the iliopsoas. And so we combine now the iliopsoas with the iliacus into the iliopsoas muscles, which are hip flexors. So our next muscle group are muscles that actually start on the hip region, and they're going to cross the knee, so they're involved in movement of the knee. So the anterior compartment are a group of muscles we call the quads, because there are 4 muscles. They all insert via a tendon on the patella, and then we have a ligament that runs from the patella to the tibia that keeps our patella in place. So the superficial ones we can see are the midline one, the rectus femoris. As we move to the lateral compartment, we have the vastus lateralis. And as we move to the medial area, we have the vastus medialis. To find the fourth, we have to remove Sartorius, and we have to remove rectus femoris. And then the muscle that sits deep to rectus femoris is the vastus intermedius. So remember, we use the word intermedius as in between. So the vastus intermedius is between the vastus lateralis and the vastus medialis. As we move to the posterior compartment of the leg, then we have muscles that have an opposite action. The muscles we just did were knee extenders, so these are going to be knee flexors. And all of the knee flexors are collectively called the hamstrings. They all insert on the ischiotuberosity. And then we have one that is lateral and inserts on the lateral aspect of the lower leg. And then we have 2 that are medial and insert on the medial aspect of the lower leg. So the lateral one is the biceps femoris. Gets its name because it has 2 origins, and it's in the femoral region. The other 2 are muscles that are referred to as the semitendinosus and the semimembranosus. The tendinosus is superficial, gets its name right here because you can see that it narrows to a tendon and has a long tendon that continues down to the lower leg. The deep muscle to it, which is still fleshy, clear down here, is the semimembranosus. So tendinosus is superficial, membranosus is deep. As we look at the lower leg, we have muscles that on the back, in the back compartment of the leg, are going to extend, hyperextend, or plantar flex the ankle. So the 2 largest muscles that we see superficial are the gastrocnemius muscles. Underlying the gastrocnemius muscles are a large flat muscle, which is the soleus. So notice that the gastrocs and the soleus come together to form the Achilles tendon that attaches to the calcaneus. So when they contract, they pull the calcaneus upward, which plantar flexes your foot. If we remove all of these muscles, then we have a muscle that sits deep on the posterior aspect of the tibia. So the muscle is referred to as the posterior tibial muscle. If we look at the front compartment of the lower leg, we have a muscle that runs right next to the tibial crest, and so it is the tibialis anterior muscle. As we move lateral from the tibialis anterior muscle, we have a muscle that's found in the lateral component of the leg. So originally it's been known as the peroneal muscle. In newer textbooks it's known as the fibularis muscle because it is setting against the fibula. And so we actually have a long muscle with a long tendon again, so it's going to be peroneus or fibularis longus. And then we have a shorter muscle that underlies it inferiorly, which would be the peroneus brevis, which isn't on your list.